Okay.
Mira, can I say something
Go
quick?
ahead.
I just had a colleague that got the message the meeting is at capacity and not be able to enter.
Oh, that is not what we were anticipating. Okay. So give me one moment. Okay. Well, this is unfortunate. We thought our Zoom capacity was higher. We will, for those folks who can't get in today, we will have to follow up with the recording, unfortunately. This was our oversight. Okay. Okay, so my name is Mira Mossini. I use she, her pronouns, and I'm the senior researcher at the Coalition of Communities of Color. So I am actually here with my colleague, Dr. Andres Lopez, who will introduce himself in a minute, but we're obviously from the Coalition of Communities of Color. We're not with Kaiser Permanente, but we are collaborating with our colleagues here, Akiko and Ruchita, on this process of getting out the calls for applications for this grant. And we've been working closely to think about how to make this process reflective of what we've heard from communities around applying for grants, and how to make it as less painful as possible. So that's why I'm here. That's why Andres is here, and we'll be supporting our colleagues at KP during this informational session. But before we get started, I wanted to acknowledge something that was also an oversight on our part. Today is the last day of Yom Kippur, which is one of the most holiest times of the year in Judaism. And because we scheduled this informational session on this day, some people are not able to join. And so we wanted to take accountability for that oversight, and just also let people know that today is one of the last days of Yom Kippur. And next time we will be much more careful in when we schedule our events. So I would also like to share with you a land acknowledgement. So many of us, although not everyone on this call I recognize, but many of us are calling in from Portland, Oregon. And I'd like to share a tribal land acknowledgement, one that has been shared with us. One of our member organizations often uses this land acknowledgement. It was developed by NAYA, the Native American Youth and Family Association. So Indigenous people have obviously lived here in the past. The Portland metropolitan area is vast and includes modern day cities such as Portland, Vancouver, and many others. It covers both sides of the Columbia River and both sides of the Willamette River, spanning into surrounding counties such as Clackamas, Columbia, Multnomah, Washington, Yamhill, Clark, and Skamania. In this broad area, there were numerous tribes, people, and villages that honored the abundance that the lands offered. We honor their history and acknowledge the sacrifices they made. In the metropolitan area, the tribes are Multnomah, Wasco, Cowlitz, Cathlamet, Clackamas, Chinook, Tualatin, Kalapuya, Molalla, and many other tribes who made their homes along the Columbia and Willamette rivers. Let us also acknowledge the robust present-day federally recognized tribes of this area, the Grand Ronde, Siletz, and Cowlitz. In addition, I'd like to acknowledge the Chinook Nation, who has been seeking federal recognition for many years. The urban Indian community is made up of tribal diversity that originates from around the country, representing at least 380 tribes. The urban Indian community has a vivid history, made up of people whose journeys have brought them to Portland by ways of forced displacement or seeking more opportunities. Today, these tribes and communities celebrate their heritage, showing resilience and tenacity that would be greatly admired by their ancestors. Welcome everyone again. I'm going to share some slides now. And with that, I will, let's see, just remind folks that this is the information session for Kaiser Permanente Northwest Community Health Grant Initiative. So we wanted to do a little introductions. So I've already introduced myself a little bit, and my colleague will, I'll turn it over to him in a second. But we are grateful to be in community with you and grateful that you are sharing your time with us. So it's, we try our best to do a little bit of relational work, even over Zoom. So again, my name is Mira Mostini. I use she, her pronouns. I'm a senior researcher at the Coalition of Communities of Color. A little bit about me is, as you can tell by this picture, I love to cook. My friend gave me an apron that has my name on it. One of the things that I love to cook the most is reflective of my heritage. So my mom is Pakistani and my dad is Indian, and there's a dish that covers a lot of parts of that part of the world. A lot of people eat it. It's called halim, and it's one of the things that I absolutely love cooking. It takes about a day and a half to cook. So I also love dancing, dogs and cats, and playing tennis. So I will now pass it over to Andres before we pass it over to our colleagues at KP. Before you get going, just.
All right. Good afternoon, everyone. My name is Andres Lopez. I use he, him, and elle pronouns. I'm the research director at the Coalition of Communities of Color. I wanted to share with you this photo that I took at the Portland Pickles game. My parents are Cuban immigrants, and baseball is very important for Cubans in Cuban culture. I also live in Southeast Lents neighborhood, a few blocks from the park. So I wanted to share this photo of me being really silly with you all. Yes, Lance, come on, Tabitha. And then this is Mira and I at one of the Mardi Gras celebrations last winter here in Portland. So we're so happy to be here with you all and to be a part of this. I just wanted to briefly share a little bit about why we agreed to support this work or why we're here. And that is because we have begun to be more accountable to our research products. So last year we put out a report on culturally and linguistically specific behavioral and mental health, which you can download on our website. And a lot of those findings were collections of things that our BIPOC communities across the state have been saying for years. But has really gotten a lot of attention of a lot of folks doing behavioral health work across the state. And so we've done some thinking about how we can be more accountable to that work and not just stop when the research is done. So some of the ways we're doing that in the short term is by sharing back those results with community, doing lots of speaking engagements across the state that have action items where we're asking partners to show us what they're doing. We also did some Spanish language analysis on the data we collected, and we'll be having a Spanish language community forum in January to talk more about mental behavioral health resources. And then we're also supporting grant making processes like this around those areas. And then for the long term, we also are doing some long-term consulting with the Oregon Health Authority and their behavioral health program and how they implement their work over the next 3 years, as well as we created a relational accountability process tool, which is a fancy way of just saying, how do you track being in good relationship with community? And we have been promoting this tool with our government partners so that they're better at tracking how they can be accountable for what community tells them and what they're doing with that information. So you'll hear more from us in our email list, but I just wanted to share that and pass it over to Akiko and Rajuta, who've been our lovely partners and will take us through the way. Mira and I will be monitoring the chat, so please feel free to put things in there if you have questions. Thank you for being here.
Good morning, everybody. Welcome. So we're going to try to balance the amount that we talk and really prioritizing making space for you to all ask questions. But hopefully the next 45 minutes or so will answer a lot of your questions. So just wanted to go through what you can expect for the next hour and a half or hour and 15 minutes now. So first, we're going to introduce you to our team here at Kaiser Permanente, or KP, who are working on this grant initiative. Then we'll give you a bit of background, why are we doing this grant initiative? Why are we doing it now? A little bit about the focus of the grant, and as well as what we'll be looking for in applications, as evidenced by the 200 plus RSVPs. So we may be doing a part 2 info session with another 100 folks, but based on that, there's clearly a demand for this. We wanted to share what we'll be looking for. Then I'll turn it over to my fabulous colleague Akiko, and she will go over kind of the nuts and bolts of the grant and the grant process, and then we will have time for your questions. So, and yes, we will be recording this session. We will be sending the slides, the recording, as well as later this week or early next week, an FAQs, a frequently asked questions document that will hopefully offer answers to all the questions that were provided in the RSVP form that we may not get to, and as well as in the chat today, or any questions that we don't get to today, and those that we do get to as well. Next slide, please. Okay, so first, I just wanted to acknowledge that there are others from KP on the call. Our colleague Kate wasn't able to get into the session, but her fabulous colleague Nina is joining us here as our mosaic expert, if you have questions about that. And also, I believe Tracy, Dan, and Grace is on the call. So, and there may be others I missed, but for the purposes of this this grant initiative, I am leading this with Akiko. And so a little about me: I've lived in the Pacific Northwest for, I can't believe it, I was just calculating it, Tam, like 23 years I've lived in the Pacific Northwest, which is kind of wild. But I grew up in Ohio in a really small town where I was one of the only brown kids. People thought I was Native American. They thought I was Latina, like everything but India, and which is where my parents emigrated in the 1960s. And so I think my identity in that sense has really formed, who I am today. And I've been at KP for about 5 years this month. And before that, I spent about a decade at the Multnomah County Health Department. And before that, various not-for-profit organizations. And I'm really excited about this grant initiative. I'm passionate about what justice can look like, not just in words, but in action, not just in content, but in action. And that's a lot more important, especially when you're, or it's that much more, I'm more attuned to it when working within a white dominant culture, large healthcare system. It's important to consider not only what we fund, but how we fund. And I take seriously the power that's inherent in the role that we hold here. And I just want to say, it's not easy. We won't always get it right. And we still, for example, scheduling the session today, and we're always learning. I'm always learning and growing and trying to challenge the status quo. And my inspiration is my son in that picture, Suhail. I'm a single parent. He's entering his tween years, but he still very much likes to cuddle and tells me that he's going to do so until like forever. And we love to listen to music, and we also love to dance and spend time hiking about outside. And that's a picture of us last year on a holiday that I think is coming up. I should know this, but it's called Ganesh Chaturthi. And I'll pass it to Akiko.
Thank you, Rushta. Good afternoon, everyone. I'm just so overwhelmed with the people who are interested in this grant initiative. And I really appreciate you taking the time to join us in this information session. And our apologies for those who want to join and could not join due to the capacity. So I'm just really appreciative. So again, I'm Akiko Betcher. I use she, her pronouns. And I work for the KP Northwest Community Health Department. I've been with the KP for about a little over 5 years. And I've been in healthcare. I started in the healthcare as answering the phones and making appointments for people in the behind the clinic offices. And not behind the clinic offices, it's the back offices. So, you know, I just have seen so many different things, and this topic is really dear to my heart, and just a little bit of my personal self and kind of related to emotional health. I love J-pop. And I've been following this group called Travis Japan. They just were on the America's Got Talent. And it might sound silly, but I realize that they make me happy when I'm feeling kind of down, overwhelmed. I spend like 10 minutes just watching them. So I'm just discovering something to keep my emotional wellness in the J-pop group. So I just wanted to share that with all of you. I'm originally from Japan. All my family's still in Japan. English is my second language, and I still struggle, but I'm very proud to be here. So I see my coworker Nina here. I know the picture's not on, but she's a very important part of our team. So Nina, do you want to come and off mute and just introduce?
Sure. Hi, everyone. I'm Nina Miyata. I'm with the Kaiser National Community Health Team. I've been with Kaiser Permanente for 12 years. And I'm actually working out of Hawaii. So aloha to everyone. I love gardening like Kate has there. I love gardening and trying to transform plants as well, seeing them grow. I try vegetable gardens over and over. Sometimes they work and sometimes they don't. But yeah, I'm happy to be here. I kind of work on the back end through the contribution system that you folks will be submitting your applications through. So if there's questions regarding that process, it would be Kate and myself. Thank you.
Okay, can we move on to the next slide, please? Great. I'm going to spend very little time on this because I really want to move into kind of the meat or tofu, as I would say, of this initiative, but just wanted to give a little bit of background. You know, mental health and wellness, broadly speaking, has been expressed as a priority by various communities going back to at least 2013 via various touch points with the community. And in 2019, actually, through our community health needs assessment, which is a cyclical process, it's an assessment that all hospitals do, I believe, every 3 years. You know, we heard it again, and we also did some community engagement sessions, and we heard a lot of the recommendations and expressed needs that you'll see in this grant initiative. And, you know, those were reinforced by the Coalition of Communities of Color's report that Andres referenced. And then the COVID-19 pandemic, the anti-Asian hate that, you know, accompanied that, the murder of George Floyd, which brought to light what, you know, more universally, what so many already know, that racism and discrimination are still very much embedded in the structures and systems of this country, that only made it clear that mental health and well-being is something that's accessible or is something that's present disproportionately more so in some communities over others. And so we developed a concept and a grant initiative idea back then, and COVID happened and all resources and energies necessarily shifted to that. But we have the green light, and we're excited to lift this back up and are continuing to hear that it's a priority. So that's just a very quick background on why this is the focus of our grant initiative and why we're doing this now. It's a long time coming. Next slide, please. So I just said mental health and wellness, which, you hear mental health, you hear behavioral health a lot in healthcare settings, but we are very intentionally using different terminology for this grant initiative instead of mental health. And that's for a few reasons. First of all, we've learned emotional wellness in our community. And we alternated between wellness and well-being. And this is the term we ended up on, but it came from community. The idea that, it better reflects the language we've heard. In a lot of communities and a lot of cultures, they don't really speak about mental health per se, either because of stigma or because it's not language that's culturally embedded, but they still speak of the very issues that, mainstream culture can often would refer to as mental health. Where this, again, it came from community, and we're also prioritizing communities that we know have face inequities as it relates to social and emotional well-being. Social and emotional well-being also encompasses more of a group and community perspective. As you can see in this visual, there's a connection between an individual's health and their family, their participation with their spirit, engaging in their faith communities, in their with their culture, connecting to their culture. And so it's acknowledging that health goes beyond the individual level. It's also more holistic. We know that different aspects of our health are interconnected: our physical health, our spiritual health, our emotional health. And this is not a new idea, a new concept. And so we really wanted to encompass those things in this grant initiative. Next slide. So now to move into what we're going to be looking for and what we'll be looking for as strengths in our applications. One of the things we're hoping to get out of this is, just that there's a lot of evidence that's lacking that challenges the dominant ways that we, meaning healthcare, other dominant culture institutions, approach mental and behavioral health. And so having evidence from community-specific strategies can have some really impactful upstream effects when we can have evidence for advocating for new ways of doing things. So we're hoping through this grant initiative, we as Kaiser Permanente will learn, and will also be investing in supporting community organizations to evaluate and measure successes that are important to you all as well. And so it may not have been completely clear in the invitation to apply, even though it was a little bit, it was implicit, but some of the things we're going to be looking at when we're reviewing the applications are, does your proposed project address the root causes of the issue you're seeking to address versus the symptoms? Does your project lie outside the walls of healthcare delivery and clinical interventions versus within them? Are your project activities at the group or community levels versus at the individual level? And then speaking to root causes, we know, in the previous slide, you saw individuals exist within the context of communities, but there are these root causes: social determinants of health, stigma, racism, colonialism, and there are others that may not be mentioned here, history of trauma. that inform our ability to be healthy. So how are you able to articulate how your project might work towards that longer term vision of systemic change? And I think I saw a question in the chat, but yes, we are going to be prioritizing those applications that are focused more, centered more towards root causes, that are at that group or community level, and so on. Next slide. I'm catching some of the comments, but not all of them, trying to answer as I see them. And some other things that are going to be scored in our application will be, and some of these will be redundant, but does your proposal connect to one of the 3 grant areas that we mentioned in the invitation to apply? To what extent is your proposed project supported by data? And here I just want to call out community stories, community narratives, stories. Those are data too. We're not just talking about numbers and metrics. To what extent is your project culturally specific or community specific? To what extent does your project build relationships both between your organization and your community and also within the community? To what extent will the project address root causes or work towards addressing root causes? How clear, and I know if you've read through the invitation to apply, you saw that there will be a co-design of the evaluation, but what is your proposed evaluation plan? How clear is that? How clear is your project budget? And we'll be scoring and thinking of these, considering these questions according to a rubric where 0 would be you're not including it at all, to 3 would be excellent. So I'm going to pause there and move to Kiko, who will go over the finer details of the grant initiative.
Thank you, Rushta. I'm really trying to look through the questions too, and we will try to address them as Andres mentioned. So just going through the kind of a structure of the grant initiative, and I'm going to read it out, but it's all in the invitation to apply documents. The duration of the grant initiative is going to be 30 months. That's 2.5 years, and starts January 23. The total amount of the grant is $1.5 million, and organization can apply up to $300,000. So if you decide that you want to work on a project that priced $200,000, that's fine. We haven't really had any applications in the past that declined that maximum amount, but we just wanted to put that out there. And I also saw that comment that it's drop in the bucket. I agree. There's not enough funding in this society really to address this topic, but Kaiser Permanente wants to be part of it. And we really wanted to respond to what we heard. So we're probably not going to solve everything, but we also want to be part of it. So that's kind of what we're trying to do. And we're going to have at least 5 community-based organizations selected for this grant initiative. We have a targeted population for this grant initiative. So Black, Indigenous, people of color, immigrant and refugee, and LGBTQ2SIA+ communities. And we say learning opportunities. I'm going to admit that we're still in progress to design the evaluation, because we want the grantees to participate in designing of it, and we'll support throughout this process. And we call it, I'm trying to read, but I think I have the comments pops up. So we're going to have peer learning and sharing in a way of convenings. So we would like to gather together, share what everybody's learning, and work together. So more to come. Like I said, we don't have everything concrete because everybody's feedback will shape those learning opportunities. So just want to share that it's not concrete everything. Also, the part of the grant requirement is to participate in the information session for the social needs referral platform. And I think some of you may have heard or already joined, but Connect Oregon and Unite Washington. Kaiser Permanente is one of the funders for this platform. It's an IT platform. You're not required to join the network, but we would like to ask you to participate in the info session. It's all online and it's 60 minutes. So we just want to let you know that's part of the grant initiative. So next slide, please.
I just wanted to say briefly,
Thank you.
I put the link in the website, but you can download the slides right now from our website if you would like to follow along. Thank you.
Thank you. Also, the eligibility criteria, because we received a lot of questions about this part. So I just want to be clear, all the applicants need to be nonprofit organizations, have the status of the 501c3 or under the fiscal sponsor that has 501c3 nonprofit status. Also demonstrate at least 3 consecutive years of programming. And I think that's also not clear to many people. So that means that we don't want the brand new organization to apply that just started maybe last month. We would like to see that your organizations have been working with the community for at least 3 years. So that's what this means. And then also the organization needs to be serving in the KP Northwest service area. And we listed all the counties here. And the counties that is that called asterisks, right? The little star, little flower thing. Those counties are a little bit tricky because not every zip code is included in KP's Northwest service area. So if you are serving or in those counties, let us know and we'll share the zip codes, the exact zip codes that we consider the service area. Okay, next slide, please. Am I missing anything? Do you have the next slide? Oh, thank you. So organizations and then also grant activities not eligible for funding is the government entities. We're not accepting any applications from government entities. And we want to note that this does not include the tribal organizations or tribal government. So if you are in that area, we'll be happy to talk with you, but we just wanted to mention it because we did not mention that on the ITA. Also, the religious organizations for religious activities are not included or not eligible for the funding. We also want to make sure that organizations that discriminate based on race, color, religion, gender identity, or expression, sexual orientation, physical circumstances, age, status as a veteran, or national origin are not welcome to apply for this grant initiative. Also, this grant funding does not include capital campaigns. That means that this funding cannot pay for like brand new building. And we just have our restrictions in those funding. So just want to make sure that you knew that because we talk about the spaces, community spaces, but that does not include the building. And then also does not include the cash reserve. So you cannot put the money away for like a future usage. So we expect the organizations to finish spending at the end of the grant initiative. Next slide, please. So this is the grant timeline, and I think most of you are very much interested on the left side of this calendar or the timeline. And I also want to mention that we have heard some feedback. Why is this such in a hurry that we did not open the application that long? And I really want to apologize. We really wanted to take this opportunity, that we had the window of opportunities to make this grant and also start this grant in beginning of 2023. As many of the funders or organizations, sometimes the opportunity comes when we're not expecting. And we knew this was an opportunity that Rujda and I could not let go. So to make the deadline, we wanted to make sure that we meet all our Kaiser Permanente grant deadlines that to get this grant go out this year. So that's why the short, there's no trick or no secrets. So I know this is not ideal, but we really want this to make it happen. So right now we are on the October 5th information session. Application deadline is coming up October 24th. That's Monday at 5 o'clock. Of course, everybody's welcome to submit the application beforehand, but we will be closing the application at 5 o'clock on the 24th. Once we closes, we have a pretty lengthy review process internally at Kaiser Permanente, and we'll spend a good amount of time in October and November to go through. And when everything goes well, when all the grants are selected and final, we plan to send the award notification between December 12th and the 15th. I know it's the end of the year and I know everybody's busy, but we really want to make sure that once organization receives the award notification, please make sure to sign the grant agreement and send it back to us between December 15th and 22nd. And the very first payment of the grant, which is the half of the grant amount, $150,000, will go out by December 30th. So that's a very short and busy schedule towards the end of the year. That's what the application process. And then 2023 through 2025, we have the grant activities, including kickoff event, convenings, reports. We're going to have 2 reports. So the first report in the middle of the grant, 3 reports. First progress report, second progress report, and then final. And then we'll finish it in September 2025. I know I went through that really fast, but that's the main timeline. Am I missing anything, Rujda? I just want to make sure.
I don't believe so.
Okay. I also want to have a lot of time for questions. So that's why I'm kind of in a hurry to go through them. So now let's open up for questions and discussions. And one thing I just want to make sure is I know there are a lot of people who could not participate today. And even if you participated, maybe some questions that you want to ask in private, or you might think of different questions later. And it's okay. You know, Rujda and I are available to answer any questions. And if we can't answer, we will ask our colleagues at Kaiser Permanente to address those questions. So I just want to say that our emails and the phones are open anytime. So, and I toss it back to Rujda.
Actually, it's tossing it back to everyone in this room.
I'm sorry. I just wanted to, you know, make sure we facilitate too.
Yes, it looks like Naya. I see you have your hand up, and help me if I miss folks, others.
Yes, hi. Thank you. My name is Naya. So I was wondering, two questions. One, so if we serve, let's say, Black and mixed youth, would we be not able to apply because we only serve a specific population? I guess I got kind of confused with the one that said if we discriminate against race, religion, like, so it's not discriminating, but it's we serve a certain population. And then my second question was, oh dear.
You just
Sorry, I got a phone call right in the middle of that.
Okay.
Yeah, I got a phone call. Sorry about that. So, so my next question then is, would be, so we're a nonprofit that's been around for a long time, but the programming would be new. This new program that we were wanting to do, would that qualify?
Yeah, so in answer to your first question, no, that, yes, absolutely. This project can, and we're anticipating will, focus on a specific population or a community. That eligibility issue was pertaining to if you have discriminatory policy, we will not provide services to this particular group based on their race, based on their religion. So it's more speaking to discriminatory policy. Regarding the second question, yes, we absolutely anticipate that some organizations will be launching something that is new and that is innovative. That's really pertaining to the organization has been in existence with existing operating programs for 3 years. Akiko, did I get that right? That would be my answer.
Yes, you got it.
Okay, thank you. And then just what if you have more than 5 organizations that all meet the criteria? How, I don't know if you already answered this, how would you guys select?
That's a very good question. And one that we're anticipating may, I don't know
That
that I
means
can
we're gonna
answer
have
that right
sleepless
now.
nights. Yeah, we're gonna have sleepless nights. That's what's gonna happen.
Okay, thank you so much. I appreciate it.
You know, I just want to mention too, you know, we want to start something like this because we've been hearing about this. And sometimes, you know, we want to make sure that maybe other funders will step up as well. So, you know, if we do this, we're meaning to share this. No, this is not just Kaiser thing. This is our community thing. So we're going to share. So hopefully the other people are going to step up too. Sorry.
Penny.
I see Tabitha.
Hi, thank you. I'm wondering about the restriction on capital expenditures. If, say, part of our programming was to source a site for a community garden, would that also be prohibited?
I believe that capital campaigns, yeah, capital, I believe that that would be prohibited.
Okay, thank you.
Mm-hmm.
I see Aisha's hand up.
Hi, thanks for hosting this meeting, and also it's just lovely to meet all of these other folks who are in this justice work with us. I'm a part of Radical Rest, which is in fiscal sponsorship with Unite Oregon, and we're relatively new on the scene, and so it sounds like from the criteria of the grant, we wouldn't meet criteria because we started in the wake of the uprising. And part of the question that I asked in the chat and that I'm really curious about is the way that this might be a model for building community partnerships amongst organizations that are already doing work. And, you know, our organization runs health justice events that are somatic, experiential, and trauma informed for, you know, BIPOC folks doing like communal, like trying to build communal care. And so this is in alignment with a lot of work that other people are trying to do, but we have a very particular sort of lens on how we do that work. And it's like, I don't necessarily need to get the grant. But if there are ways that those grant dollars are actually shared amongst community organizations, so that we're not reinventing the wheel or creating redundancies, it might actually be advantageous. So I'm just curious about how those that are sort of operating the grant application process might use that process to foster community relationships among organizations. So.
My immediate answer, which isn't the answer, and I look to Akiko and Tracy and others, but I think, I think that what emerges from this process and the feedback that we get from all of you, I see possibly another grant initiative focused on really building support for those collaborations and that capacity building coming out of this. But that's my immediate thought. Akiko, Tracy, other thoughts?
Yeah, definitely. I'm just thinking about the upstream work that we were talking about earlier, and takes innovations, right? And I always think, partnership is a great thing. We live in the same community. Why can't we collaborate? Maybe I'm speaking too much, but if any of you want to get together and do this together, testing out the innovative ideas, I really encourage you. I think we need to be together and work together. I don't know how everybody feels, but we encourage you. So if any of you just, think about it, maybe doing this together, that's a possibilities.
I want to just say something too here. Aisha, thank you for that question. Part of what I said about what we're doing, KP came to us and said, we want to do this, but we want to do it right. Can you help us? And we said, we'll do our best, right? Because we're learning too. But this is also because we are connecting the dots between KP, between the Oregon Community Foundation, between OHA, right? So we're trying to be more accountable to what we're recommending. So these ideas like that is perfect, and they are things that we want to build off of and support. So we'd be happy to chat more with you about that. And I do have some good ideas, but I know there's going to be more funding for this type of work, because we are going to be pushing all of our partners to secure that.
Yeah, and this is Tracy from Kaiser Permanente, and just want to echo all of that. We're a large organization and also connected within the fabric and infrastructure. Folks here on the call might have been involved with the Healthy Columbia Willamette Collaborative. Kaiser Permanente sits at that leadership table, and we're discussing now, what do we do collectively together? So we hope that this is just a catalyst to more of movement building in this space, and are committed to ongoing learning even past the 30 months. So I just wanted to add that.
All right, Tennis, I see your hands up.
Yeah, hi, this is so helpful, and it's really just invigorating to see all these wonderful people doing this work. I had a question. If our organization is in the midst of a large program expansion, and we've identified that within that expansion and the population that we're serving, BIPOC participants in that program have special needs as far as accessibility and just us being able to reach those communities and serve them better. So I'm just curious, does this need to be a standalone program, or would you fund a program within a program? Or, is that something you would consider when we've identified very specific needs and, really the need for addressing, a community in a specific way or in a better way than what we're doing currently?
So that's a hard question for me to answer. We've had conversations about this, and the way we've spoken about it is that, and this is with this grant initiative,
Yeah.
we are seeking to lift up and prioritize those strategies and projects that are specifically developed to be responsive and upstream, responsive to the communities we have identified, versus we have existing other investment strategies and priorities related to those kind of existing dominant culture strategies, making them accessible to communities of color, if that distinction makes sense. And so what you're describing sounds like it's kind of maybe.
I can be more specific. So we particularly right now are in the midst of a large expansion of our domestic violence shelter and services. And so what we've identified is that a hefty percentage of the folks who we are serving in that initiative are particularly women of color. And then even within that population, there's we really want to expand our Spanish speaking services, so anyways, it's not, so that's specifically what I'm referring to, is like being better able to reach these people who just really need us. And it's not a blanket approach. We're recognizing that a very specific targeted approach to serve this population is needed, and we need money to do it.
I guess, are there services at the individual level? Because that might be another, this is not an effort that is.
No, I get it. Yeah, no, it's not. It's prevention work. It's community. Okay. No, it's
okay.
Everything else is in alignment. And it's okay. I'm just wondering how to position this. And I'm sorry to make this too individual for everybody else.
And I'm sorry I don't have a really clear and direct answer.
Thank you. Mercy, would you like to go next? Oh, you're on mute.
Yeah, I kind of figured that. Thank you for this work. This kind of work is really needed in our community. I'm so grateful that somebody make it to be possible.
Sorry, Mercy, I can't hear you quite well.
Let me see. Hello? Can you hear me? Hello?
We can hear you, but it's a little bit blurred.
Is it better now?
Yes.
Yeah, it's better. Thank you.
I just want to say congratulations to whoever made this thing work. We need such opportunity in our community. I'm just so confused about how you came up to the number of folks that you want to select, 5. Okay, some people might want to say I'm 100,000 hours or 150,000, that might expand the number. But it's really scary to come up with 5. And look at the people that are on here and people that still want to come and still confused how you want to work this out. Because either I put my time in this or don't put my time in knowing that I'm not going to get it because the number is so huge. It's kind of contradicting. And that's why I really need just some answers.
That's a great question, and one that we were actually discussing right before this info session. And, I'm answering this without having spoken to my colleagues at KP, but I think so they can jump in if they see it differently. But I think we're going to be looking at the strength of the proposals more than we are. Is this proposed project asking for 300,000 over 2.5 years? And if it turns out that, the strongest applications that demonstrate that they're really focused on addressing the issues, and the communities that we're seeking to, see work happen in, then that will be a conversation we have where we might have more than 5 and they'll have less money. I don't think, my inclination is that the highest priority, I think that figure probably was that we're working with the amount we're working with is because there are often a lot of organizations that just get, $150,000 grant that doesn't really offer them the ability to build in an infrastructure that they can think about, over a longer period of time that is more conducive to sustainability. And I acknowledge that that might not work for other organizations that have a very, specific set of strategies that they're wanting to implement that aren't necessarily, don't have that larger scope. So I think I would not say that if you don't have a $300,000 grant, you shouldn't apply. Please step in if you're seeing things differently, KP colleagues, but yeah, it's not like the 5 is a hard and fast number in that sense. I think yeah, we have to be a little bit flexible here. I think it's necessary for us to be flexible based on, what we see. And I'm sorry, what that means is that we can't say this is exactly how it is, but I think that's a plus and a challenge.
Yeah, it's hard to answer just because we don't know what type of applications we're going to get and how many. And yeah, that's why the word is up to. So, what we hope is that, everyone who's applying will show what you need for your organizations and the community, regardless if it's $300,000 or $100,000. We want to see what works for your community because it doesn't mean that everybody's the same. So, and then if there are more than 5 applicants that, less amount, that we have to just work on the back end of it. So that's why we can't answer the exact. I'm kind of repeating you, Rich. I'm so sorry. I just wanted to say what I'm thinking, but
I wanted to clarify why I asked this question. Here we are today in the first meeting. It's due on the 24th. Many of us would like to collaborate, but getting in touch with other folks takes a very long time. So collaboration may not be where it's going to go for many folks, because such things that when you collaborate is easier. But also the time limit is not giving us any flexibility. If I was on your team that advised you to do this, I would say, add more people and do 1 year for the first time and see where it goes. Then next year, they will do more and do more. But since I was not on your advisory team, I wouldn't say that, but I'm saying it big now. But, so stuff like that, we need to really take it into consideration because it's very important, this kind of grant that is coming up, but for it to be very limited. But let's see what happens. Thank you for your time.
Yeah, and I just want to acknowledge that again, this is a far from ideal timeline. It doesn't allow, we would love to meet with organizations, do the interviews, have deep conversations. It is the opposite of ideal to be reviewing applications and making decisions. And the alternative is not getting out the money. And we are bound, this is where we're making changes where we can, and we still work within a very large institution that at this point is managed at the national level, not even in this region. And if we want to get the money out by December, this is a longer, believe it or not, this is a longer stretch of time that organizations have to apply than was initially on the table. And we are just, in weighing that decision, it was more important to make sure that the funds went out to the community, even though the process is far from ideal than the alternative, which is not at all. And I appreciate your question, and yeah, just wanted to acknowledge that challenge. And it's something we're kind of trying to work with as well.
Yeah, I just want to say too that about the up to 300,000. I think there's the beginning of the ITA did say $300,000 each, and in the middle of the grant amounts explanation, it did say up to. So I acknowledge that might have been confusing. So we'll make sure to add that in FAQ after this session. So I appreciate all the sharing like your, thoughts, because that's how we can improve. So thank you so much.
Thank you, everyone. So I see quite a few hands up, so I just want to make sure everyone gets a chance to ask their question. So next, Perla, would you like to ask your question?
Yes, thank you. And so this is definitely a combination of questions that I had that I also kind of saw in the chat. So hopefully it'll answer a couple of other folks' questions, and kind of moving a little bit into the administrative and financing part. And so I'm wondering if anybody can expand a little bit on like any of the restrictions around budgeting, like what are we looking at in terms of like FTE allocation? What are we looking at in terms of allowable administrative costs? And also like maybe just some of the breakdown of what would be allowed within the cost of like operating the program. And then the second question not related to financing is around the reporting criteria and the progress reports. Like what kind of reporting are we going to be looking at? For a lot of CBOs, we receive federal funding, which is very tedious and long and excruciating progress reporting. And so those are some of the things to consider for us, as well as just around the FTE, recognizing again that I work with for Programa Hispano Católico. We're a culturally specific organization, and we provide services to Latinx communities, and also like our advocates, the people out there doing the work every single day, are also among some of the people that are like not paid enough to live in the Tri-County area. And so we're really pushing hard to try to increase salaries and bring people up to livable wages. And so I wondered, is there a capacity for salaries or a cap for how much we can pay staff? And yeah, so if you can just maybe expand a little bit on those things.
Yeah, I just want to see if Nina, would you be able to answer those questions about budgeting and reporting requirements?
Sorry, coming off mute. As far as the administrative cap, I would have to verify that rate.
Hi there, this is Tracy. So let me go into kind of budgeting. We absolutely want to support administrative overhead. That's part of the grant dollars that you can include. Our typical amount is 15%, but there are reasons sometimes if that goes up or down. So that's a discussion point. As far as allocations between staff, I think that's pretty open, depending on the project and the impact and how you design it. As far as the evaluation and outcomes, I think as mentioned that Rudita and Akiko, an evaluation will be co-designed. So we're not going to do anything without you, and we will be taking on a partner. There will be some basic reporting requirement that we know as a standard. What have you done with the budget? How have you achieved your goals compared to what you've stated? Outside of that, there is more opportunity to think about what that looks like in a collective space. So again, we didn't want to design everything up front without your participation.
And just one thing I'll add, thanks Tracy and Nina, is that typically there's not like a specific format or template that we ask that grantees must use, as long as they're including the information that we're seeking. But as Tracy mentioned, a couple of questions, there will be some things that we're interested in knowing, but in terms of the overall evaluation reporting, it will be done in partnership with you. And yes, I'm saying from my colleague, Akiko, we do have a report format, but I've never actually required that our grantees use it. We just, if as long as they're providing the information, the questions, they can use whatever format works for them.
I can assure you, we don't have the same as the federal reporting requirements. I have heard the nightmare about that. No, we're not going to require you like federal government.
We have been exploring more digital ways of reporting too, so that could be a consideration. I would also suggest and support some staff time related to evaluation and outcomes built into programmatic expenses. We will want you to participate, and we also know that that takes time and staffing resources to do that.
Thank you. I very much appreciate that last portion you just mentioned because it really does. Thank you.
Thanks. Rachel?
Hi, everyone. I have a question about eligibility. I got a couple different emails before this session, and I remember one of them saying you must be a new organization being funded by Kaiser. So if you've received funding in the past, is that true?
That is not true. It was just a confusing language, and it's been corrected. It is whether you have received prior funding from Kaiser Permanente or not is not at all a factor, a consideration in whether you're eligible for this grant opportunity.
Okay, excellent. That was all I had.
Before calling on the next person, if I could, there was a similar question in the chat. If the nonprofit has existed less than 3 years, but programs have been operating for longer through other entities, but same management, will this qualify?
Can you ask that again, Mira? I'm really sorry, but I was responding to another question in the chat.
Yeah, the question was if the nonprofit has existed for less than 3 years, but the programs have been operating for longer it could be through other entities, but the same management, will this qualify?
Well, that's a good question. What do you think, KP friends? We didn't really get that specific.
Yeah, and I think what this question is trying to get at is leadership, capacity, and strength to carry out the work that you described will be happening. So that might be an individual one-on-one case that we need to talk through.
Okay, thank you. Lori. Lori Palmer. Okay, well,
I'm just trying to find my way. Hi, everybody. First of all, I would like to salute Kaiser for your efforts in the African American BIPOC community. We need, what I'm hearing from you guys on this call is you guys want to work with these.
Lori, I'm sorry to interrupt, but I really can't hear you.
Oh, okay. Wait a minute. Can you hear me now?
Yeah, a little better. Continue, please, so I can tell you.
I'm in the store and I got an audience, but I'm going to go ahead and shoot this. First of all, I would like to salute Kaiser. I am a faithful member of Kaiser for many years, going into my 60th. Lori Palmer, I am the founder of Go Get Your Child Community Violence Prevention Coalition. And currently I'm working with 7 mothers that have lost their kids to cold-blooded murder in this community. And the reason why I went out to 7 women is because the women are not being served in this community, especially the African-American mother. I went through the experience when my son got shot 6 times, 2015. I've been in school sitting here for 7 years. I qualify for this. I don't qualify for that. We asking for help out here. And what I hear is everybody on this line, you have a heart where you want to help us. What we need is the barriers to be put down. When you got programs like this and you got family members and community members that Kaiser, you're serving me. I'm in trauma. I'm in chronic trauma. And I'm trying to run an organization, trying to help back to the community out of my life when my son got shot. And I don't qualify for nothing. The men get everything. I read this program. The reason why I showed up today is just to tell you my heart. We all need to work together. We need to create a platform right here. Work together. You know what I'm saying? Roll up your sleeves. Take out your titles and all that. come to the community, hear our voices. We hear you. We thank you for you guys creating this, but you guys need to hear us and bring us to the table. So I got 7 mothers that's willing to come, and they got big cases in this community. They tied to all kind of health issues. I got health issues because of what I'm going through, the trauma. We need to serve the mothers in this community that is losing their kids and they in chronic trauma, and they receiving help over there, Kaiser, wherever, and they in your program, whatever. We need to help. You know, that's my statement for you today, and I salute you and I thank you.
Thank you so much, Lori. And, you know, I'm thinking, wow, Lori needs to talk to and introduce the women you're referring to. I have an amazing colleague this is not really a plug because I don't know, you know, where it's going to go, but I have a coworker at our national office who's specifically focused on and passionate about addressing community violence and community violence prevention and intergenerational trauma. And I think that she would love to talk to you, since it sounds like that's something you're putting forward. And so I'd be happy to connect.
Talk to her, anybody that want to help us. We need help, you know, and your skill set, our skill set, our hearts, and just come together and do it as a community. It's not about color, race, or creed, or where you work. It's about, is we doing the work? They dying in the street. Our kids are dying. Help us so we can help you.
Hi, welcome in.
Thank you.
Thank you, Lori. I saw Tabitha, you had your hand up, but I saw you put a question in the chat. Was there anything else that you wanted to add to that?
That was just it. I was wondering if organizations that received a grant would be able to award subgrants as opposed to just subcontracting.
Nina or Tracy, can you speak to that? Is there anything barring them from doing that? Or
We want to highly support collaborations, and there are ways to do that. We do not typically sub-grant. Otherwise, we would give those grants directly. But I think you're speaking to a larger issue of how to partner, and there are things that can be explored in a partnership.
So would subgrants be one of those things?
Subgrants to partners would be a no. If there were contracted services, an MOU or something of that nature, that can be discussed.
Okay, thank you.
Thanks, Tabitha. The next one who I have is Home. Home.
Hi, I'm sorry. My name is actually Felicia.
Felicia.
I just wanted to ask for any more general information that you can provide or guidance you can provide on building the budget. Anything such as, you know, making a clear distinction between operating and programming costs, or anything you can offer in terms of that, developing a good solid budget.
a quick question I'll ask is just, Felicia, have you seen the invitation to apply guidelines that speak to that in some level?
No, but if you have guidelines already published, then I can go there.
Okay.
Okay. Thank you.
You're welcome.
Thanks, Felicia. Spencer.
Thank you. I was just wondering, talking about timeline crunches for this one, and on behalf of other organizations who would want to collaborate, are we anticipating any further rounds of funding along these lines in the pipeline for this next 30 months to come?
That's hard to say. 30 months is 2.5 years. I'm hoping more comes out of this, is my vision and a dream.
I was curious if the crunch to get this one kind of rolling before the end of this year was because there was a plan in place for next year.
Yeah, the timeline is not based on something that comes out next year. Unfortunately, like it's hard to predict what, what's going to be available next year, even to us. So if anybody's interested, we really encourage you to apply at this time, although it's not much time. So.
And Spencer, I'll reiterate, Spencer, that I was just using yours. Oh, can you hear me? Oh, good. Sorry. We're in the same office. I'll just reiterate, Spencer, that there are other organizations and foundations that are also will be putting out dollars for behavioral health, and we'll be tracking all of those. So please feel free to reach out to Mira and I, and we're happy to keep you updated on what we know. I know OCF has contracted a lot of research for direct dollars to be going out around behavioral health across the state, and those opportunities may be coming out soon. And OHA is also considering some of that, and some of the folks we've heard from through the grapevine. So please let us know.
Okay, thanks, Spencer. Next I have R. Munoz.
Yes, Robert, he, him. Hey, so I was wondering if space could be provided to one of two things. One, to be able to have each organization simply list what they're thinking of doing. So that would provide us an opportunity to be able to collaborate. And also, to the extent that people did not receive funding, if we could get a synopsis of what they were thinking of doing, because if we get funding, a lot of us are trying to reach the same communities, and it would be great to be able to either partner before or partner afterwards. I work for Central City Concern. We provide a full continuum of care for the sister who was sharing about her, her brothers and sisters who are being killed in the streets. We do provide mental health and mental wellness services for African Americans. The name of the place is Imani. I'm gonna put my email in the website, and then also we are a resource for undocumented immigrants who are trying to get mental health care, substance use treatment. So if you come across people who have those populations, I know that one of the things we've been talking about doing is creating a drop-in center downtown for African Americans to get away from the racism that they deal with every day, to go and find community and find support. We're applying to another organization to build out that space. But nonetheless, it would be great for us to, I can't speak for the organization myself, although I am one of the grants and special project managers, and we need to be able to reach the people that we're trying to serve. So those are suggestions, questions that I have. Thank you.
Again, this is, we're not able to consult with one another before we throw out these answers. I feel like I suspect that it would be challenging for us to facilitate organizations connecting prior to the organizations being selected and funded, which I understand then, prevents the ability for organizations to collaborate and apply for funding together. But if the layers of approvals that occur, that need to occur require us to have a decision by the end of October. However, I could see if, with the permission of each organization, if every organization as they apply, if they were willing, we could, pull together all the applications and have a brief synopsis and potentially share that with everyone, and have, apart from this grant initiative or aligned to this grant initiative, a growing, just to start to support, to build those partnerships and collaborations for whatever might come next. I know that's not the response you probably would ideally want, but it would be a start that I think we could, make happen again if organizations were willing to have that information shared.
Yeah, I don't know if it's appropriate to share the contact information that those who interested in participating for today's info session, because we didn't get the permission ahead of time. So that would be my hesitancy. But let's talk about that and see what's the best way to, be able to share.
I think there's a way we could just ask when we get back to each organization, we can ask if it's something they're comfortable with as part of our follow-up communication.
Yeah, and any way we can get away from this sort of competitive approach. I think someone commented upon that earlier on. And that's one of the way that this white middle class dominated system does things that keeps us from being able to work on this together. So I put my email address on there. I created a statewide network in the state of Colorado. When we wrote grants, we all shared our objectives. We shared our SMART objectives and made all our applications stronger. And whoever got the funding, and we all applied together. So, Kaiser could head an effort maybe towards a national grant where we work together and we strengthen each other. So, because that's the only way things are going to change. So, thank you.
Yeah, I appreciate your feedback. I mean, it's so valuable. And yeah, this info session is something that it's so learning. So, I mean, I really appreciate your opinions.
Thank you, Robert, for that. Aisha, thank you for sharing your information and modeling some ways in which we can make connections here in the chat. So anyone that would like to share their information, their organization's kind of mission or primary area of work and contact, that would be great. Muse? Sorry, I'm sorry if I did not pronounce that correctly.
You did right. Anyway, here for that part of the world. My name is Marcelo. I'm the representative of Somali Council again. First of all, I'm really happy.
I'm sorry, Muse. I'm sorry to interrupt you. I'm sorry to interrupt you. You're coming in and out. You can't hear you very well. You're coming in and out.
Let me take the earplug off for a second. Is that better?
Can you say more?
Can you guys hear me better? For some reason, it's not catching my apologies. Can you hear me now?
Yes.
Okay, thank you very much. I sound like that commercial. My name is Marcelo. I'm a representative for Somali American Council of Oregon. First of all, I'm thankful about this opportunity that was given, even though I wish there was more, but nevertheless, 5 is better than none. So I appreciate the Kaiser to come forward with it. But also, I wanted to also appreciate, I'm glad that College Community Colors doing the work on this one, because my advocacy were mainly based on the reports they made about the African community, and they clearly stated the numbers that we have. So can we use their data to kind of support our grants? Am I still being not heard?
I didn't catch what you just said at the very end, but you were, I mean, I don't think any data sources are off limits.
That's what I was gonna say. That I think you heard that this is using the data from Coalition Community of Color, which highlighted about our communities back in 2015. I think one of the studies did, and that was the base of our organization actually being launched the next level that make us successful based on that data. So I just want to make sure if you can use that again, and looks like that's not a issue.
Yes, absolutely.
Also one quick question. I know this time is running out, but if everything's decided, will we be able to have a feedback about to us as why?
Yes, I'm not sure what form it will take, but we will, our intention is to, with full transparency, share, that's why we shared the scoring rubric today to share with organizations who weren't selected, what factors contributed to that.
Yes.
Us. Okay, thank you. Liz, go ahead.
And this is probably the last question I think we have time for. We're at 2:30.
I'm actually sitting in for a couple of organizations that probably, I don't know if they got this information or not. I'm going to forward the information. Collaborations is huge. I work with a group of artists and we've been collaborating around housing. So that's just to kind of throw that out there. The other thing that I had to say too, that kind of goes along that new and emerging groups, because even though we're lifelong artists in this area and have been doing things for over 40 years, we would be considered a new and emerging group. So if we knew who the fiscal sponsors are that are out there that are really willing to take on this work around art, around mental health, around these real specific, I think of Lori and the women that she was talking about, it would be great to know those people, those fiscal sponsors that are willing to take on and what kind of programming they do take on if you don't want to become a 501c3 yourself.
Thanks for that. I don't know that I can have that. I would have that answer, but are you asking for folks on this call?
I'm just saying whether it comes out in further information, you know, or just can somebody at least take that into consideration? Because a lot of times we don't know who we can work with. And when we do go out to find, because I've been kind of chasing down fiscal sponsors for the programming that we're doing. We happen to get picked up by a housing group. So we're going to be able to collaborate with them, but they're not our fiscal sponsor.
Got it.
Understand what I'm saying?
Yes.
So just kind of tracing down who are the fiscal sponsors. Like I didn't know Unite Oregon was a fiscal sponsor, you know, for an example that I've seen here today. So there's a lot of newer groups or smaller groups who are not 501c3s that don't know how to partner or collaborate or search for a fiscal sponsor. So that's something that I think larger organizations like KP and some of the other ones can, and even CCC can consider getting that information out to folks.
Yeah. Akiko, did you have something?
Yeah, I just reading the chat and I see, sorry. Southeast Uplift provides fiscal sponsorship. Lindsay, can you talk a little bit about that? If you're comfortable.
Yeah, sure. I'm actually the fiscal sponsorship program manager at Southeast Uplift. So we primarily provide fiscal sponsorship to groups that are working in Southeast Portland or throughout the Portland metro area. But I'll throw my email address in the chat if anyone wants to reach out. Thank you all.
Thank you, Lindsay.
Thanks so much, everyone. Andres, did you? Oh, you were just rubbing your eye. I thought you were putting your hand up. Wow, we really, you've given us a lot of fodder for thought. I'm excited. I'm a little frustrated, and I'm more excited, humbled. You know, I hope that this is the beginning of multiple conversations, and just again, we will be sending out the slides, a recording of this session, FAQs, responses to questions that may come a little later as we take some time to pull them together and make sure we get you the most accurate answers. And in the meantime, we had a parting slide just with our contact information. If you're able to put that up, just so, or you can see it when we send out the slides. And you can let us know if you have any final questions. So thanks everyone for joining today, and we will talk to you at some point in the future.
And please feel free to reach out to us with any questions.
Yes, so this thing was forwarded to some of us. How do we really get into the link, the actual link of sending the information out?
We will include a link to the website that has a link to the invitation to apply, the application instructions. That's where you will be able to go for the info session. All the information will live on that page. So we'll be sure to send that out. And Andres just put it in the chat if you have access to that. Thanks, Andres.
Thank you.
Thank you,
And I just want to say,
yeah, Lori.
I left my contact information there and I said, anybody got their heart in it, give me a contact, just give me a call. If you got your heart in this work and want to do this work or interview my women or just see what's going on with my project, I put the website and everything there. Looking forward to hearing from somebody.
That's great. Thanks so much. I'll definitely be following
you.
up, as I mentioned.
Thank you, everyone.
Okay, thank you.
Thanks all.
Thank you.
Bye.
Call my Ellie. Call my Ellie.
And do you know how we can get the chat? Is it?
Everybody,